All right, let's talk about something that most of us do without even thinking about it, swallowing a pill. We're going to crack open the science behind that little pill's hidden journey and uncover the one crucial step that decides if it's going to work at all. I mean, really think about it for a second. You pop a pill for a headache or whatever, but what's actually going on in that mysterious time between swallowing it and hopefully feeling better? What is that journey really like?
Well, it turns out that for any medicine to have any chance of working, it has to clear one single, absolutely critical hurdle first. Before your body can absorb it, before it can get into your bloodstream, it has to dissolve.
And that brings us to the star of the show today, solubility. It's just a fancy word for the ability of that drug to dissolve in a liquid, like the fluids in your stomach. Because if a drug can't dissolve, your body just can't absorb it. It's like a key that can't fit into a lock. It's completely useless.
So this introduces the first huge challenge for any medicine. It's not just about if it dissolves. It's about how fast it can do it. The moment you swallow that pill, it's officially in a race against the clock. Because here's what's at stake. If that pill travels all the way through your system without breaking down and dissolving properly, it does nothing. Absolutely nothing. It just becomes a very expensive piece of waste. So how do scientists make sure that doesn't happen?
Well, it all starts with the drug's most basic physical properties. You can think of it like the medicine's own built-in blueprint, one that dictates its shape, its size, and the speed at which it can get its job done. Let's make this really simple. Think about your morning coffee. You stir in some sugar granules and poof, they disappear almost instantly, right? But what if you dropped in a solid sugar cube? It takes way longer. It's the exact same idea with medicine.
And the science on this is crystal clear. There's a fundamental rule. The smaller the particle size, the higher the solubility. It just makes sense, right? More smaller particles means way more surface area is touching the liquid at once, which means it dissolves way, way faster.
And this explains something you've probably noticed yourself. Why does that fizzy, powdered pain reliever seem to kick in so much quicker than a plain old solid tablet? Yep, you got it. It's all about that massive increase in surface area. But wait, it's not just about size. The drug's internal organization is just as important. Some drugs are what we call amorphous. Their molecules are just a jumbled, messy pile. They're easy to break apart, so they dissolve really fast. But others are crystalline. Their molecules are locked in this super tight, ordered grid, almost like a brick wall. That structure is way tougher to crack, which makes it much less soluble.
Okay, so we've got the drug's blueprint down. But now it has to enter the arena. And that arena, your body, is basically a wild and constantly changing chemical obstacle course.
Yeah, your digestive system is definitely not a simple glass of water. It has all these different zones with different chemical makeups. And the biggest, most important factor that affects solubility during this journey is pH. That scale of how acidic or alkaline something is. And here's the general rule of thumb. It's kind of like a game of opposites attract. A weakly acidic drug, like good old aspirin, doesn't dissolve so well in your acidic stomach. It has to wait till it gets to the more alkaline or basic environment of your intestines. And on the flip side, a weakly basic drug, like certain antibiotics, actually dissolves great in the super acidic stomach. It's all about finding that perfect chemical matchmaking. But here's the twist. Just when you think you've got it figured out, there's another huge variable. It's not just your body's internal chemistry. What you eat and what you drink can come in and completely change the entire game. Let's look at the classic cautionary tale, the antibiotic tetracycline versus a glass of milk. So you take your antibiotic, then you wash it down with some milk, which is loaded with calcium. What happens next is that the tetracycline and the calcium literally grab onto each other. They form this new, clunky chemical structure that is not very soluble at all. And the result? The drug can't get absorbed properly, and its effectiveness just tanks. This is exactly why you see those warning labels at the pharmacy. Okay, this all sounds incredibly complicated, doesn't it? Like a massive challenge for any new drug. But this is where the pharmaceutical scientists get really clever. They've developed a whole range of smart solutions to basically hack solubility. They've got this whole toolkit to work with. They can use a process called micronization, which is just a fancy way of saying they grind the drug into microscopic particles. They can add co-solvents to make the fluids in your body more friendly to the drug. They can even use surfactants, which act like tiny molecular taxis that form these little spheres called micelles to carry the drug along. Or they can use complexation, which is basically giving the drug a buddy molecule to help it dissolve. So, The whole goal is to make drugs dissolve better, dissolve faster, right? Well, usually. But what if for a very clever reason, you actually wanted a drug to be less soluble?
This is where they turn the whole problem on its head for something called taste masking. Let's take an antibiotic called chloramphenicol. It works great, but it's super soluble and incredibly bitter. If it dissolves on your tongue, the taste is just awful. So scientists brilliantly tweak its structure to create chloramphenicol palmitate. This new version is specifically designed to be poorly soluble. That means it won't dissolve on your taste buds, making it basically tasteless. It just waits until it's past your tongue to start dissolving. How cool is that?
And that's what this all comes down to. By truly understanding and mastering the science of solubility, researchers can design medicines that aren't just effective, but are also more reliable and, frankly, a whole lot easier for us to take. It really just boils down to this one amazing principle. Slight modification in the molecular structure of solids may lead to marked changes in their solubility. It's a field where the tiniest, most precise changes can have absolutely massive results. Which brings this whole thing right back to you. The next time you pick up a prescription and you see that little sticker that says, take with food, take on an empty stomach, or avoid dairy, you'll get it. You'll understand the deep chemistry behind those simple words. So the real question is, what secret about solubility is that little bottle trying to tell you?